Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is the non-operative treatment of adult scoliosis. Adult degenerative scoliosis involves rotation and curvature of the spine due to degeneration. It's very different than pediatric or adolescent scoliosis. For one, it's often painful. Two, it's stiff, unlike adolescent, so it's not responsive to bracing. Okay? In adolescence, it's usually flexible, so you can brace it, kind of prevent it a lot of times from getting any worse. And in adulthood, it often causes both back and leg pain due to the arthritis and also the spinal stenosis. Why does adult scoliosis occur? There's really two reasons. One is if you had it as a pediatric or adolescent, if you achieve skeletal maturity and the curve was over 40 degrees, a lot of times it continues to get worse at an average rate of 1 degree per year. Okay? Think about it. That's not very much in the short term, but over a long time period, let's see, age 20 to age 70, you're talking about 50 degrees plus the 40 you already had, that's 90 degrees, okay? Or it can occur new. You may have no scoliosis as a child, and then due to disc degeneration leading to abnormal facet motion in the back of the spine and asymmetric arthritis, you can develop adult degenerative scoliosis. And it involves nerves getting pinched, so you can also have back pain, and I mentioned the leg pain. Well, what are the symptoms? The arthritis from the facet degeneration leads to significant back pain. Patients may get muscle weakness and aching from difficulty standing up straight. If you're bent forward or off to the side, or it can be difficult seeing the world straight unless you use your muscles a lot to put your spine in that position. Patients also can have buttock and leg pain from the spinal stenosis. So what are the best treatment options for adult scoliosis? Over-the-counter medications such as anti-inflammatories and Tylenol may be very helpful for mild to moderate pain. Prescription medications such as higher strength anti-inflammatories, neuropathic medications such as Neurontin and Lyrica, narcotics for when the pain is exceptionally bad, and then topical prescription pain creams can be helpful. Physical therapy and or chiropractic can be great. Interventional treatments also. Well, what are the interventional treatments that are available? Facet injections place steroid medication right into the arthritic joint or joints. Okay, so usually with degenerative scoliosis, you have quite a few arthritic joints, so all those can be treated. The steroid may stick around and provide pain relief for weeks to months. In addition, trigger point injections, which are subcutaneous injections, can help a lot with muscle spasms. Medial branch blocks places numbing medicine around the affected joint. So here's a joint. Well, these medial branch nerve endings supply sensation to the joint, so a medial branch block blocks the transmission of pain signals from those medial branches, and that can provide pain relief for months at a time. If that works and wears off, then a procedure called a radiofrequency ablation, which you see down here, has a catheter around these medial branches, and that can provide pain relief for 6 to 18 months. It works exceptionally well, and a repeat procedure can do the same. Epidural injections work well for the pinched nerve aspect of adult scoliosis, known as spinal stenosis. These can promote pain relief as well, so you have options for back pain and the leg pain. What are the outcomes with non-operative treatment? Over 90% of those with adult scoliosis can achieve a satisfactory level of baseline pain without surgery. Between the treatments for back and leg pain, most do not end up needing a procedure. Remember, surgery is elective, it's quality of life, it should be a last resort. Surgery does involve both nerve decompression and fusion, but it has a very high complication rate, over 50%. Adults simply do not tolerate these surgeries like they do as a pediatric or adolescent, so considerable care and attention should be given to whether or not all conservative treatments should be tried first. Top non-operative pain management in Texas, in Dallas area, is through the Texas Pain Network. There are several clinics throughout the Dallas-Fort Worth metropolitan area accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.